Optic ataxia is a type of ataxia where the patient is not able to guide his or her hand towards an object with the help of visual information. In reaching for an object, a person with severe optic ataxia may seem to grope in the dark, extending a flattened hand hesitantly until chance contact allows the object to retrieve by touch. Optic ataxia occurs as a result of damage to specific regions of the brain.
Diagnosis: patients with optic ataxia fail to reach accurately for objects, particularly when they are presented in peripheral vision. Specialized testing may be required to confirm the symptom or to diagnose its subtle forms. Typically, the examiner will present an object, such as pen, to the left or right side for grasping by each hand. That will be done both when the patient can look at the pen directly and when the patient must look straight ahead so that it falls outside of central vision. Aside from those methods of diagnosis, professionals also diagnose a person with optic ataxia by checking its family history or background to know whether it is genetically inherited through the patient's parents or ancestors. Inaccurate visomotor guidance may also be observed for the foot by asking the patient to touch a target with a toe.
Optic ataxia comorbidities involve individuals with bilateral lesions. Balin's patients suffer lesions to the posterior aspect of the parietal lobe involving both the inferior and superior parietal lobes. Patient had bilateral lesions they interpreted as involving the supramarginal gyrus of both hemispheres, but based only on position of entrance, the exit wounds in the skull. The lesions occurred separated in time suggests that optic ataxia could result from unilateral lesions.
Genetic inheritance. You can inherit a genetic ataxia from either a dominant gene from one parent or autosomal dominant disorder or a recessive gene from each parent or autosomal recessive disorder. Article reviews the current understanding of inherited neurologic and metabolic disorders manifesting with ataxia as a clinical feature. It will highlight key clinical features, diagnosis, and pathophysiological insights gleaned from molecular genetic studies as well as current treatment strategies.
Can it be cured? Well, optic ataxia cannot be cured, and also it is a condition in which some or all aspects of visual guidance, overreaching with the hand and arm are lost. But even though it doesn't have any cure, there are some remedies you can do in order to make yourself feel better even when you're suffering with this condition. So, we have physical therapy or physiotherapy, occupational therapy, and lastly, speech therapy. You can do these remedies in order to make yourself feel better, even though you know from yourself, and thus everybody would be enlightened that there are no cure for optic ataxia.